Hey YouTubers, something important, something damn important. So today's medical threads are like big ass cigar right now. So yes, medical threads are like a big ass cigar right now. So also not a doctor for last damn time. I am not a doctor for last damn time. That is my usual disclaimer. So anyway, this topic we're focusing right now is going to be about benefits of quitting tobacco in older age. So you have tobacco, cigarettes, cigars, and pipes, and chewing tobacco, and dipping tobacco, and snus, and snuff, and vaping. And basically, you have older age, which is defined as being 65 or older in the United States. I realize it may be different in some other countries, but in the United States, it is generally defined as 65 or older. So, are there still benefits to quitting smoking or quitting using tobacco products or quitting vaping in older age? And the answer is absolutely yes. There are definitely benefits to quitting smoking whenever. It doesn't matter how old you are. It doesn't matter if you're sick or not. There are always benefits to quitting smoking or quitting tobacco use, especially cigarettes, fucking cigarettes, because cigarettes are terrible for you. They are absolutely horrible for you. So there's always benefits to quitting cigarettes. Even if you're terminal with lung cancer, quitting cigarettes is still beneficial because your breathing will improve and the quality of your life, the remainder of your life, will be a lot better, a hell of a lot better. Even if you're terminal with lung cancer, you only have 6 months to live. But if you, assuming by the time you're 65 years old, this is all quote-unquote assuming you have not developed detrimental health problems. So assuming by the time you're 65 years old and you've smoked the majority of your life or used tobacco for the majority of your life, whether it's chewing tobacco, smoking, vaping, and assuming you haven't developed a heart attack or lung cancer or throat cancer by the time you're 65 years old, which unfortunately, because cigarettes are so bad for you, so fucking bad for you, a huge percentage of people by the time they're 65 years old already have permanent COPD. Actually, most people have permanent COPD by that point, and the majority of people already have permanent health problems. Or I shouldn't say the majority of people, but I should say a good percentage of people have developed serious health problems by the time they're 65 years old, especially if they started smoking in their teens and their 20s. A good percentage of people have developed serious health problems, and there are a lot of people by the time they're 65 years old who have had at least 1 or 2 heart attacks, who have developed, coronary artery disease, who have diabetes, who have permanent COPD. Most people have permanent COPD, and there are a significant number of people who get cancer by that point. There are people in their 40s and 50s and early 60s who get mouth, throat, esophageal, lung cancer, bladder cancer, kidney cancer, liver cancer, colorectal cancer, lung cancer, pancreatic cancer, stomach cancer. It's actually not that uncommon to be in your 50s and be diagnosed with a smoking-related illness, a quote-unquote detrimental smoking-related illness. It's actually not that uncommon. So even though, again, statistically these things are more common in the older population, it's not unheard of to be 55 years old, for example, and develop lung cancer. That's not unheard of. It's not fucking unheard of. So anyway, say you're 65 years old, you may have, you probably have COPD by that point, but you don't have any other permanent health problems. You haven't gotten cancer yet, thankfully, knock on wood, and you haven't developed any, permanent side effects other than maybe COPD. There are definitely still benefits. There are benefits by that point because even if you quit smoking in your mid-60s, early 70s, you may get back a couple years of life. There are statistics that people who quit smoking by the age of 30 have next to never smoking, health problems. Their health risk is about the same as a never smoker. People who quit by the age of 40, it's about 9 years back of life. People who quit by the age of 50, it's about 6 years back of life. And people who quit by the age of 60, it's about 4 years back of life. So there are always still benefits. And keep in mind, if you're not a smoker, please, please, please don't start. It's not a good fucking habit to start. It's a terrible fucking habit to start. So if you're not a smoker and you're in your 60s, don't start just for the sake of starting. It's a horrible, horrible addiction and a horrible habit to start. So never start smoking. If you're not a smoker, you're a never smoker, please, please, please don't start. Even cigars and pipes, big ass cigars stars big ass pipes is a very bad thing to start, a very bad habit to start. So, assuming you're in your mid 60s, and you haven't developed permanent health problems like cancer, you don't have like a permanent tracheotomy, you don't have like terminal lung cancer. There are still definitely benefits. The quality of your life will improve. Your emphysema will improve. The quality of your life overall. You will have less colds. Sorry, tickle my throat. Less infections. You will feel better overall, even if you're in your late 60s, early 70s, mid 70s, and you quit smoking. I knew somebody, not gonna say who it is, I'm not gonna dox the person, whatever, but I knew somebody who, for example, was in their early 70s, who I know in my apartment, and he quit smoking in his early 70s, and he's been smoke-free for a couple of years now, and there are still benefits. It's like, there are still definitely fucking benefits. It's like, so don't think it's never too late to quit smoking. Just because you did smoking your entire life or tobacco your entire life does not mean it's too late to quit smoking. Because keep in mind, you could always, even though you've been lucky so far, even though, knock on wood, you've been lucky so far, you could always, wake up one day with a severe abdominal pain or coughing up blood and go to the doctor and find out you have cancer. It's like, so there are always benefits. Even though you've been lucky, knock on wood, and you've beaten a lot of odds by making it to 65 without developing cancer, it's not to say you won't develop cancer in your 70s or your 80s or your 90s. So anyway, have a nice day. Pretty fucking cool. Bye.